Well, we wanted to do a status report on how women feel about their health in 2026. We wanted to look at women across the country and say, what is the state of women's health? And it's not good. Women are in crisis all across this country at every generation and every race, every economic group. I think the fact that women are reporting they're more concerned about their financial health and being able to afford their health care than getting Alzheimer's, cancer, or heart disease should stop us all. That should really make us go, wow. It should really make us go, wow, that women still don't know that they're vulnerable to Alzheimer's disease. It should make us go, wow, that they still don't understand that menopause impacts multiple body systems. The good news is, of course, is that when women do know, when they do get the knowledge, which is why the forum is so important, they act differently. And so I think that's a hopeful sign that when women learn that they're more vulnerable to Alzheimer's disease, they want to know, what can I do? When they understand that they're going to perhaps become a caregiver and that that's going to be financially taxing and emotionally taxing, they want to know, what can I do? They want to learn about when they should start saving. They want to learn about how to plan for a long life. Women live longer, but they don't necessarily live well longer. And I think that this should be a national conversation that we're having, because the state of women's health concerns all of us. Women are providers, they're partners, they're parents, all these P words, and they're caring for our society as it grows older. And that's incredibly stressful and incredibly financially taxing. And so often women are spending all the money that they've saved on other people so that when it comes time to their own care, they're left broke. The fact is, we have very little research into women's health overall, so we don't know why women get 80% of the autoimmune diseases. We do not know why women get the majority of MS. We don't know why women are 2/3 of those diagnosed with Alzheimer's. We don't know, which then, in order for us to know, means we have to fund research into women's health spans. That's critical. What we do know is that women are terrified that they're not going to be financially able to care for their health. That's terrifying. So I want women to know right now that they have to be the CEOs of their own health, that there are things that they can do right now to take care of their brain health. There are things that they can learn right now about being perimenopausal and menopausal that affect their entire system. They can speak to their daughters about their health. They can begin to put aside money starting at a very young age to help them when they get to my age. Now that may be difficult, or it is really difficult when you're living paycheck to paycheck. So this is a conversation, a financial conversation, it's a health conversation, it's a family conversation about who's going to care for those who are older. And so often that befalls onto a daughter.
We're also dealing with the Medicaid cuts right now that are happening that, Nebraska just put them into effect. Ohio has already had a work order for people on Medicaid. Your take on that for people who are, in the paycheck to paycheck category, what can they do?
Well, they can vote for people that care about these issues. I think that first and foremost, we have to begin to look at women's health, caregiving, Alzheimer's as political issues. So if you have somebody running in your neighborhood, in your state, it's important that they talk about these issues. It's important that they tell you their plan for you as you age. It's important that they tell you, do they have a caregiver's policy and or platform? Do they have a women's health platform? What is their plan for your one wild and precious life?
One of the concerns we have with pharmaceutical companies, there's not enough research, you brought this up, not enough research about women, getting into these clinical trials. And there's a number of reasons for that because, our hormones, our life stages are so different when it comes to testing these medications. What would you like to see from the pharmaceutical side of things to get women tested?
Well, I don't think there is a reason that women aren't in these trials. The reason is political will. The reason that we have not been included is because people thought we were little men. The reason is that we were not included because people didn't want to include women. It's not about your hormones. It's about, that's an easy, like, oh, women are like volatile. But that's an old, archaic, patriarchal argument. So this is a political will and political passion conversation. Women are 51% of the population, and they deserve more research into their health spans. Period, end of story.
We're seeing.
And it's really important that those sex differences be looked at, racial differences be looked at, because Latino and Black and brown women are more vulnerable to Alzheimer's than white women. Why is that? What's going on with women who live in rural areas? What's going on in maternal health? What is it? Why are women 80% of the autoimmune diseases? Why is that? So we need a president, we need a federal government that says, wow, we have done a tremendous disservice to women. Let's rectify that right here, right now.
We saw that financial issues, especially relating to health care, is guiding people how they're voting in this current election. What do you see coming in November and in the next 2 years?
Well, I'm not a fortune teller, and I don't know, what's coming, but I think it's time for a reckoning, right? I mean, I would feel like there's some kind of reckoning coming if you see all of these polls. Really, even amongst Democrats and Republicans, people are concerned about being able to afford their health care, not just now, but in the future. The health care of their family, not just now, but in the future. And people are making really hard decisions in our country about whether to eat or go to the doctor. About whether to eat or go to the doctor. That should concern us all. So I think that this is not a Republican or Democratic issue. This is a human rights issue. And we don't know how to keep women healthy until we understand what is their health span. What is the impact of birth control on the brain? What really is the impact of multiple pregnancies on a woman's life? What is the impact of perimenopause and menopause? What is the impact of osteoporosis? What is the impact of less protein on a woman's life? All of these are really valid questions, and we're met with I don't knows. And so we should want to change that. We should want to fix that. We should want to get those answers so that people can live healthy, emotionally, mentally, physically, spiritually lives, work, provide for their families, take care of their families. That is a basic human right.